And now in this second video, I'm going to be discussing a little bit more about what to expect in these lab weekends and your practicals. So what your first big practical exam, the first lab weekend will look like, and your assignments. So let's go to our first module, which is our first lab weekend, which covers the upper extremity. You can see here we have your assignments. You have intro to palpation assignment, intro to goniometry assignment, and intro to manual muscle testing assignment, and then your pre-lab assignment. All of these are due prior to you coming in that first lab weekend. I did make all of these due on the same day, which is Thursday, prior to that first lab day on Friday, May 16th. However, I highly recommend that you spread these out, and that's why we did post this class early, so you can start working through some of these. These first three assignments, the intro to goni, intro to palpation, and intro to MMT, these are something that you're going to want to bring into that first lab weekend and check your answers, because we will be reviewing our answers. And so you might want to change some of your answers. So make sure you either bring your computer or a hard copy of this assignment so that you can review your answers with ours on that first lab weekend. Next, I want to point out this pre-lab assignment, and I'm going to actually go into the page here to explain a little bit of what this assignment is prepping you for. So this is really a great assignment to get you first off into your lab packets on goniometry and manual muscle testing. And this is a great review for your first practical exam. So I have linked your practical exam on this page as well. It's also in the Canvas course, so you can see what that looks like. But first, I'm going to explain this assignment. So for this assignment, I want you to first review these handouts. These are basically all of the range of motion testing and manual muscle testing that will be fair game on your first practical. So I have them all linked here, and this is a great review for range of motion and manual muscle testing. Remember, on these, if you click the picture, it will actually send you to PhysioU, which will have the PhysioU instructors perform that assessment. What I want to remind you is this, for palpation, we really like the way that we teach palpation, and we find that PhysioU isn't as comprehensive to understand their palpation techniques. So you can watch PhysioU if you would like, but know that we are probably going to teach you a more precise way to palpate some of these palpations. I have linked the palpation handout we give you in class, and that we'll be covering in class. So these are all the palpations that are fair game for your first practical. And I have linked down here below the palpation videos that we have in Canvas of us palpating some of these palpations that are on this list. So you are going to be reviewing these documents prior to doing this assignment. Then, once you've reviewed, you're going to go to PhysioU down here and complete these mini sim cases that I've linked here. You're going to do 2 for manual muscle testing of the upper extremity and 2 for range of motion testing of the upper extremity. And I have listed the patients that you are going to be completing this mini sim case on. Once you have completed, you are going to screenshot your certificate. An example of what that will look like is right down here below, and you will submit that into this assignment below here. You should have a total of 4 of these to submit, because you have 2 manual muscle testing patients and 2 range of motion patients that you're completing this mini sim case on. So this assignment is, you can see, a little lengthy and might take you a little time. This is why I want you to get ahead of the game and start working on this early so you can start reviewing all of this information. Down here below, I did give you some helpful study tips. I think for goniometry and manual muscle testing, flashcards have helped my students in the past. I gave you examples here of how I would write out my flashcards for range of motion and how I would write out my flashcards for manual muscle testing. So this page is going to be super helpful to get you prepared for your first practical. So let's just review that first practical just so you know what to expect. So here's your palpation portion of the practical. You're going to get 8 of these palpations, and you will have to palpate them on another peer. You can see here the grading scale that we use to grade you on these palpations. So if you find the structure with no problem and efficiently, you get 10 points. If you get majority of the structure and maybe require a little extra time, you get 8 points. And then you can see the rest of the pointing scale. 4 points if you get one of these above, or maybe you're off a little bit more on one structure. So here are all the palpations that are fair game. You're going to get 8 of these. Next, we have our manual muscle testing practical. Anything that's fair game for testing manual muscle testing is listed right here. It's just the upper extremity, remember. You will pull one of these manual muscle testing techniques. You will perform it. This is what we are looking for with the technique. And this is how many points it is. So that anything that's starred here is a critical element item. What that means is if you do not do these correctly, it will be an automatic fail for that action. But that's okay. If you accidentally mess up on an action, you will get an extra one. And so you will pull another motion here and be tested on that. As long as you pass that, you are absolutely okay. Then you will get a 75 since you had to pull an extra one on your retake. So we have our goniometry. So here's everything that's fair game that you could pull for your goniometry upper extremity measurement. You will pull one of these and perform the task. Remember, anything that is starred is a critical element item. So if that is not achieved by the clinician, then the clinician or student will have to pull another motion to test. So as long as you pass that second motion that you get, that is absolutely fine. You will just get a 75% on the one that was needing the retake. At the end of the practical, you will have to document how you would in a chart the goniometry measurement, along with the axis, the movable arm, the stationary arm, and the normal range of motion for that joint. You will have to do the same for manual muscle testing. The difference is you will write the documentation how you would in the chart, but then you are going to tell us the main movers for that muscle or motion that you tested. So that's a nice overview of your first practical. Remember, this will be tested on your first Sunday of your first weekend. So as you're starting to review these handouts in your course, please reach out if you have any questions.